Thanks for staying with us here on the AM show. It's a Relationship Friday. We set the record straight with, is it safe to kiss and have sex? Would you get COVID-19 if you did so with a person with COVID-19? Well, we thought we were expanded a little bit on our Relationship Friday segment here on the AM show, and even asked the question, how safe is intimacy with a partner around this time? How far can you go? What can you do? What can you not do? Especially if you don't live in the same house with this partner of yours. Reverend Professor Kwamina Sego is a virologist, Department of Medical Microbiology, University of Ghana Medical School. He's joining us. He will take all your questions. Hello, Prof. I see you there. Good morning to you.
Good morning. How are you?
Very well, thank you, sir. Thanks for joining us. We put the post on Facebook, so I want us to go to Facebook first and look at the questions that have come through. You're also free to join us via phone on 0302-211-69102. Here's something, as someone says, my girlfriend was asking me why I never smiled at her ever since we started dating. She has forgotten that she told me she wanted a serious, okay. Let's take the questions unrelated to the conversation out so we can deal with the specific issues on this matter. Okay, so this one says.
Okay, so
Prof, let me take some of the. Let me take the responses that have come through on Facebook, and then we can continue the conversation. Kelvin Mauli says, "For me, I will kiss and kiss again." Oh. So Kelvin, certainly not afraid of kissing around this time. Charles says, well, intimacy and kissing is for married couples, not in so-called relationships. But if you're married, why not? No fears. So Charles making his comments known there. Redikov says, kiss or no kiss, you will still die. So kiss and French kiss deeply. Ayo, we hear you. Any more? Al Hassan Husseini says, until Corona goes, no kisses. Simply that. Stephen says, this is the evil COVID-19 had come to establish. It's called distancing. I like that. Isaac says, the thing has come to stay, so why should I fear? Yen Konkwa. All right, Isaac, we hear you. Jomo says, never ever, always ready to shoot my missile because I was born before Corona. COVID-19 can't take my joy. Jomo Yao also making his comment there. You can join us on 0302-211-69102. I've got the WhatsApp number also going to be on the screen, so you can also send me WhatsApp messages. So Reverend Professor Kwamina Sego, you did set the record straight with the kissing and the sex, but what more must we know about this?
Okay, thank you, and good morning to your listeners. First and foremost, let me make a few brief comments. I'm sure most people have smartphones, and you have screens. After you clean it, just clean it maybe with alcohol or something. Just observe over a number of hours after you've spoken on the phone, the number of spots or saliva spots you may have on the surface. That gives you fairly an idea of how transmission can easily occur if you are not covered on the mouth. So since the virus can come through our saliva and through the orifices of our mouth, the face, we need to have in mind that it doesn't have to be seen for you to get it. The second thing I want to say is that we should put all this in a family context. In a family, you're already living close together. I mean, your children come to you, your wife is sleeping on the same bed, your husband is by you. The family already has some level of intimacy and closeness. So normally, if you get it, your family will definitely be one first line of contacts that will be tested to find out if they are really infected. So with this context, and the last thing, I just also wanted to make another thing in the context of family, what Charles said. Charles said that sex has a context. And of course, as a Reverend Minister, first and foremost as a Christian, and then as a Reverend Minister, I'd want to make this clear. I mean, we're talking about the context of marriage, because if you keep going out from place to place, even going to a shop, going to different places, that's why I say stay home. You are increasing your risk of being infected with SARS-CoV-2. So if you want to have an expedition, or you want to do some sort of well, let me call it expedition, or we want to go
door
around,
to door.
You are fond of kissing others, etc. Well, that's your business. You should bear in mind that the more people you go around kissing, the increased chance of getting infected, because you don't know where those people have been, you don't know where others have been. So you are just increasing your probability of getting infected. So that aside, there are quite a number of studies that have seen. I mean, there's one by the Journal of the American Medical Association. This was published on 7th May 2020. And they looked at 38 people with COVID-19. 6 were positive for the virus. And I want to make a distinction here that COVID-19 is the disease. The virus itself is SARS-CoV-2. So there are people, for example, going around carrying...
Hello, Prof. Sorry, Prof, we lost you a little bit.
Can you hear me?
We lost you a bit because of the connectivity. I can hear you clearly now, but you have to go back a little.
Okay. I said there was a study by Chinese in China and published in the Journal of the American Medical Association. Are you hearing me now?
Yes, sir, I can.
Are you hearing me now? Okay.
Yes.
And published on 7th May. And I said they followed up 38 COVID-19 individuals. 6 were positive for the virus, that's SARS-CoV-2, in semen. Okay, and 4 out of the 6 were acutely ill, and 2 were recovering. And from this study seems to suggest that as you advance in the disease state, the likelihood of possibly having the virus in your semen increases. I have also seen a study which shows that we all have said that the virus is not viremic. It doesn't circulate in the blood. But again, there's been a study that seems to, or some studies, but at least that seems to suggest that when you have an acute stage, that's critical illness, you...
All right, there we go with the sound messing up again, but it's only because of the connectivity issue. Samuel is in Techiman. He's been holding. Samuel, good morning. Hello, Samuel. Okay, I think I lost Samuel there, but Reverend is helping us understand a bit of the science this morning, except that we just lost connectivity with him, but we'll get him right back. But let me read some of your messages that has come through on WhatsApp. This one says, I think it's not safe to kiss or have sex unless you sanitize those places. We're also going to put that question, very interesting. Can you sanitize those places, as you put it? Is it safe to use the sanitizer there? This one says, our ladies are fighting us because of social distance. Some don't believe that coronavirus is real. That's from Atta in Wa. This one says, the coronavirus has come to stay, so there's no need to worry about it. Or not, no corona will still die, so there's no need taking away our joy after all, man must live. Okay, so this one says, it is a fact that distancing goes beyond every fiber of our being as humans, but knowing how deadly this disease has a potential of becoming, I wouldn't risk my safety on intimacy. Kindly add your name when you send me a message so I know who we're connecting with. And if you've got questions as well, you can kindly send it through so we can ask Reverend. This one says, coronavirus has come to stay. It is not a policy of any political party. Tom. All right, I don't know where the politics came in from in this comment. But Rev, do I have you back? Okay. Is this Samuel we have back?
Yeah.
All right. Samuel, good morning. Yes, sir. Let's hear you. Good morning, Samuel. I can hear you. Go ahead.
I'd like to say, in many African countries, on the borders, they are checking truck drivers. These people are passing through Ghana freely, coming in from Burkina, Niger, and Mali, the truck drivers. And these people are bringing the problem into Ghana without notifying.
Okay, Samuel, here's the thing. You're saying it as a fact. But if you've got concerns, is it a concern that you're raising? But the way you're putting it, you sound like you're saying people are coming in with a disease. You can't say that categorically. Okay, can we take someone off the line, please? We can't get him making wild allegations like that. I would appreciate it if there's a comment that you want to make, if you want to ask questions on COVID, even not related to this relationship conversation. I would appreciate it, but don't make wild allegations that we can't substantiate on the program. So apologies to you, Samuel from Techiman. I feel your passion, but you've got to tone down. All right, so you can also give us a call on 0302-211-6912. On this specific issue, please stay in line. We're dealing with this issue of intimacy. Daniel is in Takwa. Good morning, Daniel.
Good morning.
Yes. Yes, Daniel, you're good?
I'm good.
Nice. Okay, so is it a concern you have?
It's a concern I have. And what I have to say is that people are really taking this virus for a joke. But the reality on the ground is that people are really dying with it. And it's a joke to die. So if somebody has a girlfriend, I think the person should really give a break for now. And after the pandemic, everything can come back to normal. It is not, we are not in normal time. So anybody who is in any illegal relationship should be able to, in fact, that is how I have to put it. The person should be able to understand that times are not the same.
Okay, but so Daniel, you've also heard that, Daniel, you've also heard that the World Health Organization say we may have to live with this disease. So for how long can people hold back?
Well, we still have, for now, we have to hold back for a while. The World Health Organization, I think, is an organization where there are human beings. And everybody now, though they are experts, but I can say that they are not God. So whatever anybody has now to say might be a prediction. They cannot completely tell that the virus can be there with us forever. Okay,
so are you holding back or you are married?
I'm not married.
So you're staying apart?
Exactly.
Okay.
Exactly.
All right. Very interesting. Daniel, thank you for opening up and sharing. Let's hear from Kwamina. Kwamina is in Kumasi. Good morning to you, Kwamina.
Good morning.
Yes,
I want to ask you to relay this to the Chamber of Mines. The workers in the mining companies are not allowed to go home. And therefore, for about 2 months to 3 months now, they are not able to see their wives and their kids.
Okay, wait, hang on. Are you saying the workers in the mining companies?
Yes, please.
Which specific area are you talking about?
All the mining companies, Anglo Gold, Newmont, Adamus, all of them.
They are not allowing the workers to go home?
Yeah, because they don't want them to contract the disease. And now this is a situation where we have to live with the disease. So how long are they going to keep the workers here from their families?
Are you a worker yourself or you have personal relations in there?
I have personal relations there.
Okay, all right. Okay, well, thank you for the information. We'll do the necessary follow-ups and get the responses. Desmond is in Bolga. Good morning, Desmond.
Yes, good morning. I'm Desmond from Bolga here.
Sure. Let's hear you.
All right. Actually, concerning on this issue, I think it's actually an issue we are all supposed to take so serious in such a way that most of our youth just think maybe COVID-19 is still just like a joke. And it started just Les, who has been arrested yesterday for this kind of misinformation. Possibly there are other people who have less idea about what's going on. And I think still our public education must still go on.
Okay. So are you staying away or you're married?
I'm single. I'm staying with my parents.
Okay. Yes. So you're not doing any intimacy stuff?
No.
Is it because of COVID-19 or that's just your principle because you're not married?
Yes, that's just my principle.
Okay.
And I live with a very respectful family and I keep that.
Okay. All right. Okay. Thank you for sharing, Desmond. Let's hear Isaac. Isaac is in Adesso. Good morning, Isaac.
Yeah, good morning, Mama.
Good morning, Isaac. I hope you're good.
Yes, so
great. Well, thank you. So, are you staying apart? Answer my question. Are you staying apart or you're married?
Oh, I'm married. But
okay.
I'm not living with my wife. She's at German and I'm at the.
Okay, all right. Go ahead. We're
my
listening.
concern is, with regards to the washing of hands, it's like the nose mask issue is replacing that one. And people are not washing their hands at all. You go around and you see the vertical basket and the tissue and the soap and other thing. But whether using it now, you see, everybody is just championing the use of the nose mask.
So, Isaac, is it something that you've witnessed yourself in a particular area?
Yes.
Okay.
Yes, something that I've observed. We have a market over here. And before the...
What's the name of the market?
I just say we have a market here. So I went to the market, we have a market twice a week, Mondays and Thursdays. Before the issue, we started the market.
Okay.
So Monday and Thursday, I went to before the issue of the you realize everybody is tapping water by them wash. But this time around, you see the water, but nobody is using it.
Okay.
And another issue I've also observed is that, with regards to the district assembly and the municipal assembly and that thing, we want to see them themselves doing something with the people within the community. But they are always waiting for the issue from the top. Whilst they them with the people at the local might be doing something, but we don't see them doing it.
Okay. All right, Isaac, thank you for raising these issues with us. In fact, after this conversation, our next conversation is to touch base with the district assemblies, so we check out how they are enforcing these restrictions, particularly those areas that have been identified as hotspots. So thank you. Prof is back with us. Prof, we lost you, but we've been hearing from people who are watching. I'm not sure how long you've been hanging on and so what you have heard, but you were trying to explain some research with us before we lost you.
Okay, so I suppose I got to where that 4 of them, the 6 out of the 38 had the virus in the semen. Did you hear that?
Yes, sir.
Okay, so basically what I'm saying is that it looks like a severe disease. And I did mention the other one as well, that for they also find the virus in blood in acutely ill individuals. So it looks like in severe acute condition, you may have the virus in other body fluids apart from just what we know as respiratory or the saliva, respiratory transmission or through the salivary transmission. So basically what one needs to do is to take a decision, because one is at home, you are close to each other. The second is that you are married, and then for that matter, you share the same bedroom. You do things in common at home. It is left for you to decide what decisions you want to make. For example, it may sound weird, but do you use a nose mask because you're not sure where you have been to or what you have probably been infected, whether you are asymptomatic at all? Because now they are not testing everyone. Okay, there's a big option also of deciding that, well, we want to wait and see how things would go. Sometimes people travel for 6 months and go for short courses and come back, and they are still intact. So it's not an unusual thing to be able to wait. But if as a couple you think you can't wait for that long, there are many styles in sex. There's also, you don't always have to look at someone's face and then breathe into the person's face. There's also the option of wearing a nose mask, which may seem funny, but if you think you can't wait, then there are options. I heard one of the callers complaining about the market. Let me say this. I think that what we need to get is, how does the virus behave and how is it transmitted? Once we get these basics right, we wouldn't expect government to come and tell us everything we need to do. So, for example, if you are going to have sex, they should come and tell you what you should do. you know how the virus is transmitted. You know that it can come through respiratory secretions or salivary secretions. And so you want to avoid that from coming into contact with that individual, your wife or your husband. So what do you do to prevent that? These are basic things. Or you go to a supermarket and you're going to buy something. You don't expect government to come and tell you that clean the handle before you hold it. And when you finish everything, sanitize your hands. We know that virus can stay on objects after they come from our body. So we need to know the basic things so that we can take the basic precautions that we need to take.
Rev, somebody raised the issue of sanitizing places before you get intimate.
I don't know how that is going to help. Well, of course, generally people will say that before you get intimate, you came from town, you are sweating, so people want to have their bath. That is fine. But in terms of sanitizing places, the virus is coming from your respiratory tract. It's coming from your mouth, it's coming from your nose. I don't think you're going to go inside and sanitize your nose and then come out. It's not realistic. You can't sanitize places. But normally people want to have a bath first. That is understandable. So in case you've gone out to pick it from anyone, anywhere, it makes sense, because as you go to places, you know that sometimes people even open doors with their elbows because they don't want to use their hands. So it makes sense to have your bath. So that assuming you have the virus anywhere on your body, at least you wash it off. So it makes sense. It has some scientific basis.
Okay. But
in terms of sanitizing your genitals or your mouth, I don't know if you're going to pour sanitizer into your mouth, okay? And then again, I've just been told by my wife. My wife actually is an obstetrician. She just sent me a note. She says that you don't never put sanitizer in your vagina or your mouth. I mean, this is an emphatic statement.
Okay.
Do not sanitize your vagina or your mouth. Don't do it.
Okay.
It doesn't help. There's no scientific basis, and it won't help you. It will rather cause irritation. Yeah.
There was also the issue of mouthwash. Was it? I saw it somewhere on social media about using the the mouthwash before kissing.
When the virus has infected the cells in your mouth, and you use mouthwash, it doesn't help, because the virus is coming from the cells. It may reduce what is in your airwaves and your mouth at a particular time. But sex is not a 5-minute go. I mean, then you are just satisfying your pleasures. But if you do it for a period of time, the chances are that there's no evidence that as you breathe, the mouthwash will continue to help. Because mouthwash itself, a hydrogen peroxide, yes. So you may reduce some quantity. It doesn't mean that everything will be completely taken away. So I wouldn't suggest that you should do it, yes, because the mouthwash on the market, the amount of the amount of chemical in there that can kill the virus may not be sufficient to be able to do that.
Okay. All right. Let's take some more questions and comments on WhatsApp. This is from Obed. Obed is in Banana Inn. Obed says, hey, why are people being so negligent? Sex and die untimely or live to fulfill your goal. Guys, be wise. Now, death is no joke. With the hashtag, let the wise hear. Obed, thank you for sending this message. This one says, I think COVID-19 can't take our enjoyment like that. Something can be done about it. Suleimana Mohammed in Kintampo North sends this message and says, and even if after playing romance with your lady, man, you still sanitize those parts of the body. So the sanitizing those private parts is also coming up, but we've heard it strongly. It is not safe to sanitize your penis or your vagina. That's clear. So you have to take it. This one says, Suman from Mankasim says, no, as Samankesi says, as the virus is now going to live with us, like the other diseases like HIV, diabetes, etc., we just have to observe the protocols, practice strict personal hygiene, and have positive mentality. I believe with God on our side, we're more than conquerors. That's Isuman from Asamankes is sending this message. Here's another one, says, please, a COVID patient sneak to a town from Kumasi. Okay, and I'm not going to continue, but it's information that we're going to cross-check before we share on air. This one says, we can kiss after COVID-19, so please distance. Distance is the key, you say. This one says, I'm Prince from Kufuridia. Can you find out what is, okay, not exactly related to this conversation. This one says, kindly ask Prof whether he's head of the vaccine. Is that the question you're asking? It's not very clear. His head, kindly send your message back. You're linking it to Malawi and stuff, but make it very clear so I can read it and not make mistakes. This one says a lot of people think that, I guess it's okay to be when both are sure you have not been to anywhere and that both of you have been observing that measures or the measures put in place. Romeo Odro from Enyinem sending this message. Okay, this one says, by the way, you still can give me a call on 030221169102. Just one more message and then Prof would react. Hi, Mamavi, the caller who called and said mining companies don't allow workers to go to their homes is not true. The companies don't have accommodations in the bush there for any worker. His relative is lying not to visit them. James in Kumasi. All right, so James is bringing a response to the earlier caller about the mining workers. All right, so sex and kissing boosts the immune system of the body. Okay, this is another, sounds like a myth, but somebody's just sent it to us. Rev?
Yeah, I mean, if we have something to boost the immune system of our body and not get infected, then let's distribute it widely for everybody not to get it. It shouldn't be only for sex when you're going to have sex. But I think that, and again, let me say this, you can't just boost your immune system overnight. It's not just sleeping and waking up. These are healthy eating habits, among others. So let's just be straight. People will still get infected. We know the roots of infection. And we know that's why we are wearing nose masks, because we don't want to leave droplets on surfaces for others to touch. So we're using nose masks. So if we have that in mind, let us make that guide us. Now, the second point I want to make, remember that you have an increased risk if you go kissing one person to another, because it's just simple mathematics. I mean, if you have a stable partner, you are okay. Even if that person is getting into contact with others, you are likely to contact it. But if you have several people who are also likely to get into contact with others who are infected, then you are just increasing your risk. I think that each couple should, based on the knowledge of how the virus is transmitted, should decide for themselves what they want to do. Some may want to wait for a while just to see, because you see, we need to bear in mind that the disease is still unfolding. We still do not understand everything yet. At a point, we didn't know that the virus could be found in semen. Now we are finding that critically ill people have the virus in semen. There's no evidence, though, that it's transmitted through sexual contact. In other words, there's no evidence that it's a sexually transmitted disease. So we need to know that the disease is still evolving. And so with time, we'll be able to take decisions for ourselves that will be helpful for ourselves.
Yes, a related question says, I think we should have, or comments, I think we have to use more contraceptives to avoid the virus passing through semen. Emmanuel from Jasekang in the Oti region. And Rev, I don't know if you want to react to that. We're not sure if it is transmitted through, but if you protect yourself using the condom, it should give you some protection.
I prefer to say we don't have any evidence that it's sexually transmitted. And then from the evidence I have seen now, I haven't seen all the papers though, it seems to be the severely ill. I don't think a severely ill person is going to have sex anyway. So I am not too worried. If you are married and you want to have sex, that's fine. But because you see, the receptors for the virus are found in different organs, but are abundant in the mouth to the lungs, through the lungs. And we know the disease that has come. The symptoms are mainly respiratory in nature. So once there's no evidence that this is sexually transmitted, I don't have worry. I think the worry is more what you do during the act to prevent each other from getting infected, assuming that one of them is even an asymptomatic carrier and does not know. What do you do to make sure that if one of you is an asymptomatic carrier, you don't transmit it to the person, your partner or your spouse?
All right. 2 last calls. Robert is in Kanishi. Good morning to you.
Morning, Mama. How are you?
Very well, thank you. Yourself?
I'm also good.
We thank God. Let's hear you on this.
Yeah, Mommy, I think that when it comes to sex, if you are not married, whether there is COVID or not, it is no-go area. You don't have to do it, whether there is COVID or not. If you are not married, you don't go in. But if you are married couple, COVID cannot regulate our sexual life. Because we are there. I mean, we have to.
But at least, are you mindful that you have to take some precautions?
Oh, madam, we are married. We need to do what we are doing. And we have one relationship, we have one sexual partner. My wife has one sexual partner, myself and her. Why do you have to be afraid of ourselves? We shouldn't allow this thing to regulate our sexual life.
Okay.
I want to ask Professor one thing. Virologists, they have been virologists for long. They know how the virus behaves and those things. My problem is that for all this while, so they can't find vaccine for it. They should come out with something, professors, doctors. Let's help the nation.
All right.
Thank you very much.
Thank you very much for those comments. But remember that this is a novel coronavirus. Bright is in Takwa. Good morning, Bright. Hello, Bright.
Good.
Oh, hi, Bright. I think I'm to brighten the conversation a bit, but your connection is terrible. I can hardly hear you. Bright, try again.
Good morning, Mama.
Good morning. Thanks for joining us. Let's hear you.
Yeah. Mama, I'm calling from Takwa.
Okay.
Yeah. The social distance is not working in Takwa. You know, the police in Takwa are trying to obtain and let them do the right thing. You know, but men in Takwa are not doing nothing at all. They're not even protecting themselves. So let them say something to them.
Okay, all right, we're here. Thank you for bringing that to our attention. This one says, Prof said something about sex. So I want to have sex now. What do I do that can protect us from the virus? Rev, we've got just some few minutes to go in wrapping up this conversation. What if somebody somebody is not married, they can't stay away, they may not want to have sex, but they may want to do other things, touching and kissing, and how far can you go?
You just mentioned it. So I think that, you see, I think that as individuals, we should all agree that we want to take decisions. We are adults. We want to take our decisions into our own hands. It's obvious. That's why I started with saying that if you look at your phone, as you speak all the time, look at the droplets that go on your phone. And if we are saying that even these fine droplets are a danger to can facilitate transmission, so we should wear nose masks. Then, if you want to go kissing people, then you should know that there's a risk involved, and you should take your responsibility for what action you take. I mean, it's as simple as that. You can't force people not to do that. And I wouldn't play the ostrich and say people are not doing it. There's a lot of premarital things going on, but that you should bear in mind that you are taking those decisions at your own risk. You take the decisions that come, the consequences that come. Let me please say this again. You see, I'm not saying that married couples should not have sex. Let me give you a scenario. You have little children. You are not sure whether you have underlying conditions, the spouse. Maybe you should be checking your basic fundamentals. We are still learning about the disease. Okay, people who may not have underlying conditions may even get the disease. That is, may fall ill either mildly or severely, assuming that both parents leave the house, have you ever asked yourself who's going to take care of your children? So there are practical things involved, and every family has to take a decision for that.
Okay.
If you think you get somebody to take care of your children for you, if something happens in the event that both of you are taken to the hospital to take care because your conditions are such that you have to be put on a ventilator or you need hospital care and that they can't take care of you from home, then immediately you ask, then who takes care of my children?
So I hear you say that before you think about being selfish and do things that you feel your body is calling you to do, think about everything else, including your family and children.
You should have a total picture of what is happening in life.
Okay.
And that's what life is all about. If you've decided that you want to be a family person, then you should think about the family and not yourself.
Okay.
And then the second thing is I heard about the vaccine. These are my personal opinions. They are not, you see, history has shown us that we've always had challenges of having respiratory vaccines, vaccines that for respiratory viruses. And so I am a bit wary of trying to force and push a vaccine in as quickly as possible, because there's been instances where vaccines that have been produced would actually resulted in people becoming more severely ill when they came into contact with the real virus. And these were also respiratory viruses. So my point is that if we're going to get a vaccine, we need to make sure that that vaccine is properly tested, clinical trials. You know, they can speed up clinical trials, but in the end, you want a good outcome for the vaccine so that when somebody encounters the virus data, it will not become rather detrimental to the person's health.
Okay.
So it's important for us to focus on prevention and to look at ways in which we can live our lives
All right.
in the current context that we have.
Okay.
And hope that we will even get treatment, because even if we get good treatment, reliable treatment for the virus itself, then what we would be doing is that we probably will gradually have to accept that we'll have to live on. I mean, the vaccine also depends on the kinds of vaccine. My literature tells me coronavirus antibodies may last for 3 years. So is it that we're going to vaccinate ourselves constantly every 3 years? There are many issues involved. It's not just producing a vaccine and using the vaccine.
I guess it's a matter of time, right? But Prof, thank you very much for your time this morning. Thank you for helping us with this very difficult, tricky issue of intimacy around this whole COVID-19 times. There's a question, or somebody sent me an issue with your sick son. We're going to try and see if we can connect you with Dr. Kama, who would help you. So please, you've sent me a message. I may not get back to you immediately, but I will before we close the show.